And what's even more sad is that of all the issues, the core issues that we fight for in this country that are coming to the surface now more than ever, it has to be the issue of healthcare. Because this is not even debatable anymore.
No.
You now have, as a result of the entire COVID scam, and what I mean by scam is this idea that you didn't actually have to have any requirements. Like they proved that the most deadly pre-existing condition to the COVID virus was having diabetes. And that
all these booster commercials are infuriating.
Oh, look at listen, Travis Kelce, I'm looking at your
Yeah, no,
man.
seriously. I was going to say, every celebrity that is whoring themselves for big pharma right now, I will not forget that. Like that it is not going to age well.
Absolutely insane.
It's just not going to age well.
And so
we see you now.
And so if you had diabetes, if you had any type of pre-existing conditions that statistically would show that getting the COVID vaccine, especially, and we're not talking about Moderna. You got the Pfizer one, right? I got Pfizer. I got Pfizer. Pfizer was the only one that probably has the least amount of side effect issues, but the amount of issues with the Moderna vaccine, well, listen, I think a lot of people feel that way.
I only did it to go to the concert I wanted to go to.
I only got it because I couldn't travel.
Well, I wanted to see Jackson Browne and James Taylor.
Once it was proven that you couldn't actually, that the virus couldn't, you couldn't stop the transmission of the virus by getting the vaccine. At that point, you had to stop forcing people to get this shit. But by doing that, what you have proven beyond any doubt is that the only way you prevent something like this from ever happening again is if you have a single payer universal healthcare system. You must remove private insurance and big pharma from the equation. There's no other way. They will always figure out a way to fuck you over and get rich doing it.
I held strong for a long time, I'd like to say. I held strong for a long time, but it was Jackson Browne with James Taylor.
Jackson Browne with James Taylor, Sable. There you go. It was Jackson Browne with James Taylor.
Together.
That was it worth it?
We'll see. I don't know. Whatever the side effect. I haven't had any horrid side effects that I have noticed from having the vaccine, but I don't know if it's worth it. But it was a really good concert.
So the reason we're bringing this up is we're going to play you one clip today, but it's very important because a man by the name of Brigham Buhler went on with Joe Rogan the other day. He is a former top executive at I don't remember which pharmacy. I think he'll mention it, which pharmaceutical company he was working for. But he basically explains how, from working on the inside, whether during the pandemic or not, that our for-profit health system is a scam of all-time scams.
We should get him to come on and invite Wendell Potter on at the same time.
That would be wonderful. So
clinicians don't know. Like a lot of clinicians don't even know about pharmacy benefit managers. The only reason I know is because I've been in every aspect of this business, and then I would get into it and I go, oh God, that's why that was happening. Okay, now I get it. Now I get the magic trick. I understand what you're doing here, how you're moving and shifting profits and monetizing disease states. If I can monetize your diabetes, why would I cure or prevent your diabetes? And I know if I'm a bigwig at United or Cigna, that you're going to switch jobs in 3 years. And by the time that diabetes leads to metabolic disease and a cascade effect that puts you in a hospital that costs me more money, you're somebody else's problem. Or
I thought we knew this.
But this is a lot of common sense that not a lot of people know about. And when you're able to get, and this particular clip on Rogan that just dropped today already has over 1.5 million views, which is great because there are a lot of people that are not aware of just how corrupt our for-profit health system really is. Stop saying healthcare because it isn't about care. No. It's about profit and only profit. And if that means, as he's saying, our goal, even if it means you have to die, is to make money. That's it. That's it.
If I can stall it long enough, you're the federal government's problem. And so every aspect of healthcare is focused on that quarter. Another terrible example of surgery, and this is honest to God. I talked to my buddy who's a president at an orthopedic company. He told me he was sitting down with a surgery center about joints. And there's a new joint that they have, and it's more expensive, but the efficacy data of the long-term benefits on it astronomically outperform the other joint that this hospital system was using. He sat down with the CEO of the hospital, and he said, here's the data, 5 years out, here's what we're seeing, da-da-da-da-da. The CEO said, I don't give a shit what happens 5 years out. Swear to God, this is a call I had yesterday. He said he looked me in the eye, Brigham, and he said, if you told me that this joint will last at least 90 days and it's cheaper, that's all I care about.
Oh my
because
God.
all of their data and records and accountability are only on the first 90 days. That's it.
He just said it. He said the only thing that fucking matters is this quarter's profit line. That's it. Nothing else. And until you remove this component from our health system, we're all fucked. And there are people out there who champion. I was naive at the time when Obamacare passed, and I thought that this was something that, all right, maybe we'll get some. There was one improvement and 10 things that made it worse. You had pre-existing conditions waived, and that was it. But the for-profit component
is still there
exponentially under Obamacare. It got even worse.
Yeah.
And so when people try to defend, oh, well, no, more people have cut. Remember, the only people who will tell you that everything's fine are people who live comfortably.
It's not healthcare. I just say the health industry. You just say the health industry.
Which is what it is.
Because I don't know what else is.
Once you're out of that 90-day and you've done your little review and all that, you're off again and you're no longer a monetizable patient. And so too, when we talk about primary cares and what's happened, the same thing with pharmacies where they've been gobbled up by insurance companies, if they're in the insurance model, is the same thing that happened with primary care practices. The day of a primary care being independent and a free thinker is over. They're employed by hospital systems.
There it is. There it is. You no longer have the right to think. You're going to just do what you're told. And if you don't do what you're told, we're going to kick your ass out and find somebody else. It's like that guy, the chunky balloon guy whose last name happens to be Fauci, who did a land grab in the West Bank. And they confronted him and they said, well, you stole this person's home. Well, if I didn't take it, somebody else is going to take it. So the attitude is, if you don't do what we tell you to do in this for-profit health system that we have, if you even attempt to speak out against what we're doing, we'll kick your ass out and we'll put somebody else in. You know why? Because we'll pay them hundreds of thousands of dollars a year to do what we tell them to do. That's it. When you have more money than God, you can bribe anybody. And the problem is that some people are really cheap to buy off. Some people you don't even need to pay that much money. You get slimy fucks that I see on social media all the time, literally jerking off to Joe Biden, and you only have to pay them a few $1,000 a month to tell everybody how great he is.
Yeah.
Pretty cheap. That's a cheap whore, Just
conglomerates have gone out and bought up the primary care practice. Why? Because now they have the patient population. If I can get you at the primary care level, then I can control the referral of where that primary care sends you as we profiteer off your disease state. So you go to a primary care. Let's just walk through the same example I gave earlier, a methylfolate test. They never run that test, right? There's genetics. The methylfolate test tells me my genetics, but there's epigenetics. The choices I make every day impact which genes turn on and which genes turn off. If nobody ever has a conversation with me in my 30s about my hormone levels, about getting into the sun, about eating right, and you push me towards chronic disease because you wrote me a prescription to treat a symptom, and now I go through this system and I get cancer, that primary care is going to refer me to an oncologist. And that oncologist is part of that same system. Most people don't know this. 65% of an oncologist's income comes from chemotherapy.
That's horrifying. Not surprising, but horrifying.
So here's one thing that I want to share that I don't know if I've ever mentioned before. I never took ivermectin. I don't really care if people take it. But the one thing that I never forgot when this was a thing, particularly when Trump suggested that maybe taking ivermectin if you can't get
he also just said people to drink bleach.
Well, that's true. There are stupid things that he will say. But the one thing that was constantly repeated when it came to the issue of ivermectin was this idea that ivermectin is horse dewormer. Yes, it's horse dewormer, and there's a human form of ivermectin. And this idea that were there perhaps certain instances where somebody took horse dewormer?
Oh, there were.
Yeah, but this idea that there's no such thing as human ivermectin. Ivermectin is used by billions of people around the world. In fact, I think it's like one of the most common forms of medicine in Africa. So the idea that you felt the need to tell people you're going to take horse paste if you take ivermectin, the only reason you would say that is because you have this for-profit system that literally has it in a stranglehold, that if you don't do exactly as we tell you, we'll end you. Like, that's their attitude. Now, we had to get past that point, but here we are now. That's why 65% of oncologists' profit comes from chemotherapy. They want you to die. And if you survive long enough that we could take as much money out of you as we possibly can. Am I wrong?
No, but when I see that, I also look at the root of that problem is pharma, not the oncologists. It's the cost and the price and the chemo and all that stuff. And yeah, they want to keep people alive, but to treat people. And I mean, look, I've been saying this for years. Cancer is extremely profitable. They don't want to cure cancer, this is one of the reasons, and I say it all the time, I don't do disease curing donations. I don't race for the cure, run for the cure. I don't do anything for the cure. I don't donate.
Come on, you don't stand up for cancer?
I don't stand up for
kind of a selfish person.
I don't do any of those things because the reality is all those are slush funds for big pharma. And by the way, we're already subsidizing them anyway. The problem with those kinds of things, and that's the same thing I say, this is why I don't do that with, like, other than St. Jude's. I do support St. Jude's, but that's different.
Oh, you're a hypocrite.
Well, no, because that gives money to families whose kids are there. And I know people who have to go to St. Jude's because their kids.
St. Jude's has a pretty good reputation from what I understand.
It's not, yeah, for me, it's just about you're helping people get through the worst thing they've ever been through in their life. But it's not about, finding the cure. That's not, that to me is just the pharmaceutical companies taking more money than they already get from us.
No
and they
question.
take it for us in the NGO sector.
And this is a big part of it.
From the markup they're making off your chemotherapy, 65%. And I attached that link, Jamie, too. Russell Brand said this, and he was spot on. Another guy who's not a clinician but understood what's going on here. If we make things about profits and quarterly earnings and big business and not patient outcomes, don't be shocked when we get phenomenal quarterly earnings and piss poor patient outcomes.
65%.
65. And I attached the link just so we'd have it.
So they have a financial incentive.
Yeah.
Wow. This is incredible.
And so I say all this again because I don't think that a clinician's to blame. They're just operating in the system that they're given. They're playing with the playing field that's been set before them and the rules of the game that have been set before them. But when patients say, why would I go to Peter Attia? Why would I go to Gary Brecka? Why would I go to Ways to Well? Why would I go to a cash pay clinic? You will not get these treatment modalities, and you will not have these conversations, and you will not do that deep dive. So in a dream world, what I'm envisioning as we build this multidisciplinary institute here in Austin and we open these facilities across the country is a lot of the care will be virtual and will be managed from the comfort of your own home, driven by large language models that are tying into your wearables and all those things we talked about earlier. But we first have to establish a baseline. What do I mean by that? If budget was no constraint and you could afford $1,200, I would say you come in, you do a DEXA, you do a VO2 max. Those two data sets alone allow us to calculate your all-cause mortality risk. I know how much visceral fat you have. I know how much subcutaneous fat you have. I know how much lean muscle mass you have on your left quad versus your right quad. I know your bone mineral density. Then we add in a VO2 max test. Yes. If you can be in the top 25% of VO2 max, you reduce all-cause mortality by 400%. Okay, so now you combine that with a DEXA. Now you combine that with a gut biome. Now you combine that with a gene test where we know what genes you have, what are your genetics. Now we can help guide you on how to prevent epigenetics, how to prevent and use epigenetics to prevent disease states from chronically manifesting. And we can truly get proactive and predictive. We can truly prevent chronic disease.
They don't want that. That's never going to happen.
Therein lies the problem, because chronic disease is where you make the most money. Think about it.
Yeah.
Think about the biggest COVID killer, which is diabetes. You have to take insulin every day.
Oh, yeah.
Think about how expensive that is. And when they talk about, you see, this is the one thing that the Biden administration is going to brag about, that they reduced the cost of insulin down to $35
It wasn't
a
them,
month.
though.
No.
It was actually Trump.
And then they just took the credit for it.
Yeah,
like a lot of
actually,
people
they
take the
held
credit
it up for a long period of time.
Mhm.
So whoever died actually in the interim between Trump doing that and Biden's taking the credit for it, all of those people could blame Joe, because Trump is actually the person who set that in motion.
Yeah.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.